Hello, everyone. Hope you're all having a great day so far. Welcome to my 14th episode of Season 2. Today is Wednesday, April 7th, 2021. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, I keep diving into those SMRC audits and keep sharing all my compliance tips. This week, I get into polysomnography, or sleep studies. And I also discuss a newsworthy update for all the hospice providers, coders, and billers out there. I get into modifiers GV and GW. And I also share some inspirational words from our beloved American author, Mark Twain. If you've checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help your providers paint the medical picture. If you like what you're hearing, go ahead and hit that subscribe button now so you don't miss an episode. Please write in a review and 5-star rating on Apple Podcast or wherever you listen to my podcast. I'd really love your support. Now, a quick disclaimer. Before I get started on the episode, this podcast episode and Nexsen Pruet podcast series do not constitute legal advice, but I am fortunate to work with sound healthcare attorneys at Nexsen Pruet. And as their consultant, I have over 10 years of experience in front office, back end, coding, and billing for multi-specialty physicians, compliance, and auditing for both E&M and surgical operative reports. Again, the opinions and insights throughout are mine alone, and they in no means constitute legal advice. So, let's get into Newsworthy. Now, I've already shared a prior Season 1, Episode 10 on Hospice Modifiers based on my years of billing them, appending them compliantly in the Novitas jurisdiction. But guess what? Now Palmetto GBA has released information of their own that I've deemed newsworthy. So let's get into some background information on hospice. Our Medicare patients are entitled to hospital insurance through Part A, who have terminal illnesses and a life expectancy of 6 months or less. These are the patients who have the option of electing hospice instead of standard Medicare coverage for treatment and management of their terminal condition. Now, hospice care is available for 2 90-day periods, as well as an unlimited number of 60-day periods during the remainder of the hospice patient's lifetime. However, a patient may voluntarily terminate his or her election period. Now, when hospice coverage is elected, the patient waives all rights to Medicare Part B payments for services related to the treatment and management of his or her terminal illness during any period his or her hospice benefit election is in effect, except for professional services of an attending physician, which may include a nurse practitioner. Now, the Notice of Admission, or the NOA, sometimes referred to as the Notice of Election, the NOE, is not required, nor is it reviewed for payment, and therefore you should not be submitting the NOA or the NOE to Palmetto GBA along with your Part B claims. To be covered, hospice services must, of course, be reasonable and necessary for the palliation or management of the terminal illness and related conditions. The individual must elect hospice care, and a certification that the individual is terminally ill must be completed by the patient's attending physician, if there is one, and the medical director. That's the physician member of the interdisciplinary group, the IDG. Now, nurse practitioners serving as the attending physician may not certify, nor may they recertify the terminal illness. A plan of care, or the POC, must be established before services are provided. To be covered, services must be consistent with the plan of care. Certification of terminal illness is based on the physician or the medical director's clinical judgment regarding the normal course of an individual's terminal illness. It should be noted that predicting life expectancy is not always exact, right? So even if Medicare requirements give a life expectancy requirement, our health treatments have soared above and beyond, right? Hospice patients are living. They're living longer. Now, let's talk about some of the details about the attending physician. Now, only the direct professional services of an independent attending physician, who may be a nurse practitioner, may be submitted. The costs for services such as labs or x-rays are not to be included on the claim. When the attending physician or nurse practitioner furnishes a terminal illness-related service that includes both a professional and technical component, that's through our modifiers 26 for the professional and TC for the technical, like in our x-rays, the attending physician submits the professional component of these services to the carrier, and they would look to the hospice for payment for the technical component. Likewise, the attending physician will look to the hospice for payment for terminal illness-related services furnished that have no professional component, like in all of our clinical lab tests. Now, let's discuss Hospice Modifier GV. Now, appending the GV modifier indicates that the attending physician is not employed, nor are they paid under arrangement by the patient's hospice provider. This modifier should be used by the attending physician when the services they render are related to the patient's terminal condition, and they are not paid under arrangement by the patient's hospice provider. Claims from the attending physician for services provided to hospice-enrolled patients may be submitted to Palmetto GBA with HCPCS modifier GV. This is true regardless whether the care is related to the patient's terminal illness. HCPCS modifier GV signifies that, number one, the service was rendered to a patient enrolled in a hospice. Number two, it signifies that the service was provided by a physician or non-physician practitioner identified as the patient's attending physician at the time of that patient's enrollment in the hospice program. Now, if the service was provided by a physician employed by the hospice, HCPCS modifier GV, again, may not be submitted. And if the service was provided by a physician not employed by the hospice, and the physician was not identified by the patient as his or her attending physician, HCPCS modifier GV, again, may not be submitted. Now let's move on and talk about hospice modifier GW. The GW modifier indicates that the service rendered is unrelated to the patient's terminal condition. All providers must submit this modifier when the services provided are unrelated to the patient's terminal condition. Claims are submitted for treatment of non-terminal conditions under Medicare Part A. Now, effective on or after January 5th of 2019, any services submitted without the GV modifier under the conditions outlined above will be denied. Now, let's discuss HCPCS code G0337, which roughly is defined as hospice pre-election evaluation and counseling services. That's HCPCS code G0337. They're only payable when submitted by a hospice to its regional home health intermediary, also called the RHHI. But let's expand this HCPCS G0337 definition a bit more. This code reports an evaluation of a terminally ill Medicare patient by a physician who is either the medical director or an employee of the hospice. This hospice consultation service is available to those who have not made a hospice election, nor have they received a previous hospice consultation. It includes an assessment of the patient's need for pain and symptom management, counseling regarding hospice and other care options, and may even include advice regarding advanced care planning. The patient or his or her physician must request this evaluation. Now, also, if a new patient physician evaluation and management service through our more traditional E&M codes of CPT codes 99201 through 99205 are submitted for the same date of service by the same physician as HCPCS code G0337, of course, those CPT codes 99201 through 205 will be denied. I hope I made that clear up above when I stated a more vibrant extended definition for HCPCS code G0337. Now, services unrelated to the terminal condition. Any covered Medicare services that are not related to the treatment of the terminal condition for which hospice care was elected and which are furnished during a hospice election period may be submitted to Palmetto GBA. Submit these services, of course, with HCPCS modifier GW, which is defined as service not related to the patient's terminal condition. Now, all providers must submit this modifier when this condition applies. Now, let's talk about care plan oversight. Attending physicians may submit care plan oversight services for a hospice enrollee. Now, for you to dive in deeper, go ahead and refer to your Medicare Claims Processing Manual, Chapter 11, Section 40.1.3.1. Now, for managed care enrollees, hospice election. Federal regulations require that Medicare fee-for-service contractors maintain payment responsibility for managed care enrollees who elect hospice. Now, go ahead and dive in deeper again and refer to that Medicare Claims Processing Manual, Chapter 11, but look to Section 40.2.2 for more information regarding claims for our Medicare Advantage or Part C plan enrolled patients that have elected hospice services. So much information, so much regulation in hospice. It's clear the complexities of hospice documentation requirements, and therefore the subsequent coding and billing are a continued demand on our providers' attention. And if we continue to look the other way or maintain following outdated advice or guidance, or by maintaining our CMS updates from years past and not looking at things currently, or from a different jurisdiction completely, it's more than likely, in my opinion, that a post-payment audit will eventually show up at your doorstep and create the inevitable mess and mayhem that I've seen. So I always recommend start self-auditing your service claims and coordinating documentation to ensure you are meeting compliance. And now it's time for my best practice tips in Trusty Tip. So let's dive into my compliance tips here in part 5 of my SMRC audits that are blasting in across the country. Remember, these are the 16 new Unified Program Integrity Contractor, the UPIC audits, that are being conducted via the Supplemental Medical Review Contractor, the SMRC, at Noridian. Their function is to conduct nationwide medical reviews of Parts A, B, and DME providers and suppliers as directed by CMS. It's the responsibility of the SMRC to review medical records and related documentation to ensure that claims are processed in accordance with CMS guidelines. Now, I provided you with details for 4 in prior episodes that involves durable medical equipment or DME supplies in our non-covered skilled nursing facilities or SNFs, as well as spinal cord stimulators and outpatient hyperbaric oxygen therapy, also called HBOT, as well as diabetic testing strips or DTS audits that are in the spotlight. So let's get into part 5 of my SMRC audits. The 5th is titled 01-024 Polysomnography Notification of Medical Review. Now, polysomnography, or PSG, is a type of sleep study to diagnose and evaluate sleep disorders. Now, Noridian SMRC is conducting post-payment review of claims for Medicare's Part B and B of Part A polysomnography claims, again, our PSG, our sleep study claims, billed on dates of service from January 1, 2018 through December 31st, 2018. Remember, these are the time parameters. Now, this notification includes the reasons for the review, as well as documentation that will be requested in the additional documentation request letter, the ADR letter, as well as resources that providers and suppliers may wish to consult with as they're submitting claims. Now, some background on the why. Why on earth is this happening? Now, back in June of 2019, the OIG released a report titled Medicare Payments to Providers for Polysomnography Services Did Not Always Meet Medicare Billing Requirements. Now, the findings from that report disclose that from January 1, 2014 through December 31 of 2015, Medicare paid freestanding facilities, which are facilities affiliated with hospitals and physicians, approximately $800 million for selected polysomnography services, which consisted of CPT codes 95810 and 95811. Now, previous OIG reviews for polysomnography services found that Medicare paid for services that did not meet Medicare requirements. These reviews identified payments for services with inappropriate diagnosis codes without the required supporting documentation. So, we've all been well aware, right, that there have been issues at large with the OIG based on these prior year's findings reports, right? And of course, in Season 1, Episode 17, I also provided my trusty tips on proper documentation and billing on polysomnography as well. Of course, the reason for the review is critical, and they provide that, thank goodness. They are narrowing it down in scope for us. CMS has tasked the SMRC to perform the medical record review on the validation of polysomnography to support the performed services were reasonable and necessary for the level of service billed. The scope involves Noridian performing data analysis and conducting medical review. Noridian SMRC will complete the data analysis and review activities in accordance with applicable statutory, regulatory, and sub-regulatory guidance. They are honing in, of course, on CPT codes 95810, which is defined as polysomnography, ages 6 years or older, sleep staging with 4 or more additional parameters of sleep, attended by a technologist. And they're also honing in on CPT code, of course, 95811, which is defined as polysomnography, ages 6 years or older, sleep staging with 4 or more additional parameters of sleep, with initiation of continuous positive airway pressure therapy or PAP therapy or bilevel ventilation, attended by a technologist. Now, the revenue codes on claims that they're looking at are for 13X for hospital outpatient, 85X for critical access hospitals, the cause, as well as 519 for other clinic. Now, of course, there are documentation requirements as well. I'm going to go over a list of 12 very specific documentation requirements that will be addressed in your ADR letter as well. These are items that you will have to furnish to support your claims that have already been paid, right? You're under post-payment audit review. Now, the first item that's going to be required for you to submit is the Advanced Beneficiary Notice of Non-Coverage, that ABN, if it's applicable. The second item that's required is a list of any non-standard abbreviations used throughout the documentation. The third item required is going to be the physician's consult letter for treatment, if that's applicable. The fourth is going to be the documentation to support the necessity of the sleep study services billed, including the patient's symptoms or complaints related to one of the following conditions: sleep apnea, narcolepsy, impotence, or parasomnia. Now, the fifth requirement is all progress and treatment notes for the claim dates of service. The sixth item required is the sleep study test results and interpretations, including documentation to support action taken based on those results. The seventh requirement is going to be the physician order for the billed service. The eighth item required is going to be the valid clinician signatures, including signature attestations and signature logs, if applicable. The ninth requirement is going to be a signature log including the printed names and signatures of all personnel documenting in the patient's chart. The 10th requirement is going to be for the copy of licenses and or certifications for all personnel documenting in the patient's chart and or if they're performing services, including the physician interpreting the test results, as well as the technician performing the test. Now, the 11th requirement is going to be the documentation to support the sleep center or laboratory's credentials. And finally, the 12th requirement is the documentation to support the reason for repeated sleep studies, if applicable. So, remember, these post-payment audits are a sign, a signal that something may be amiss in your documentation, your coding, and your billing. These 12 requirements are a very good reminder that you should be making checklists and improving your workflows and efficiencies at your practice to ensure all documentation is being captured, coding and billing are compliant per each and every payer in your payer mix. So, a better, smarter approach is one that's proactive and starts by painting a clear, rich, and vibrant medical picture the first time, so your certified medical coder can then abstract codes with accuracy. And finally, in this week's inspiring quote on greatness in Spark is from our beloved American author, Mark Twain. Keep away from people who try to belittle your ambitions. Small people always do that, but the really great make you feel that you too can become great. So very true, right? I know I've had experience with this same statement. So many who try to keep you down, who may be intimidated by your enormous potential. But I know it is that hunger within us all that allows us to grab on, take hold, and finally soar. I find that life has an uncanny way of opening doors, allowing the right people in, joining you on your bigger path, your wider road to greatness. Those people allow your light to shine, your ideas to bloom, your value to be seen. These are the people happy to share you, collaborate with you, let you lead for a bit. I agree wholeheartedly that great people want you to join them in greatness. I am happy Mark Twain's spark still burns brightly in all of us today. So that wraps up today's episode. Please go out and make this a great day, an incredible week for yourselves. Go do great things, aim a little higher, do a little more, and give back in any way you can in 2021. There's so much each one of us can do. Remember to keep masking up, washing up, and staying physically distant. We're not all vaccinated just yet. So, as always, I appreciate you diving into today with me. And if you would like to inquire about my consultant services, you can always reach me through my email address at nexsenpruet.com. I'll leave links to everything in the show notes below. Please continue staying safe and healthy, practice safety for one and all during our collective life in the time of coronavirus. Thank you for listening in on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.